welcome to my channel, which I have named Page2Plate, my VSG story. My name is Sherry LeClaire. I'm an independent author, an editor, and a teacher, but none of those things have really to do with why I've created this particular channel. I've created this particular channel to kind of document or journal my pathway to bariatric surgery, and in particular, vertical sleeve gastrectomy surgery. For those of you who don't know, vertical sleeve gastrectomy surgery is a type of weight loss surgery, and in particular a metabolic surgery, where they remove up to 80% of your stomach and kind of just leave like this little sleeve, which is why it's called vertical sleeve gastrectomy. But it's the shape of a banana, and sometimes it's even smaller. I've heard them refer to it as like the size of a cheese stick. But it depends, because there are different sizes you can have it done. Before I go further in this video, I just want to mention that I'm all for body positivity. You should really love the body that you're in and the skin that you're in, and don't let anybody else kind of give you a hard time for it, right? Just love yourself, love the body you're in. The reason why, or the main reason why I've decided to go this route with my surgery, is because I've been having those comorbidities I talk about. And in particular for me, I have like sleep apnea, and I have severe back pain. So I have osteoarthritis in my lower spine, and it's been really difficult for me to move around. And I just spent like pretty much a year being a lump because I was in too much pain to actually move. So that's why I'm going for the surgery. For me, I've gone a long time being overweight, and while I've tried to lose weight before, I think that I wasn't really highly motivated, because being overweight and looking overweight, that was not a big motivator for me, because it didn't really bother me how I looked. And in fact, in many ways, I wore my weight like a shield. And I'm sure there's a lot of you out there who know what I mean by that. So this is not my first rodeo, and it's not my first go-to. First of all, I want to mention that weight loss surgery is not the easy way out, like a lot of people will say. It's not. It's just not the easy way out. There's a lot of preparation and commitment you have to put into it, even to just get qualified for the surgery. And then after the surgery, if you don't want to regain your weight, because you can stretch out your pouch and gain weight again. In order for that not to happen, you really need to be committed to this new lifestyle. One of the things I've learned over time and in my many failed attempts to lose weight is that weight is not in our control. A lot of people think it is, and in fact, our society conditions us to think that weight is in our control, but in reality, there are only certain behaviors of ours that are in our control. But there are many, many things that aren't in our control, such as hormones, genetics, and a bunch of other factors. In fact, I'm going through the Halifax Obesity Network, and they have a bunch of videos on their website for prospective patients like myself. And there's a video where they show this big list of like a whole bunch of different factors that contribute to being overweight, and all these like arrows and lines going from one to the other. It looks really complicated. But the point is that there's way more things involved in being overweight than many people think. It's not just about eating at a calorie deficit and exercising. It's not just about that. So let me tell you a little bit about my history. So I wasn't always overweight. For me, when I was a child, except for when I was a toddler, because I was a chubby toddler, but aside from that, most of my childhood and in my teenage years and into my early to mid-20s, I was normal weight. In fact, for probably the last couple of years of high school, I could have been considered underweight. I was really small. After, say, my mid-20s, my weight started to creep up slowly over time. But after that, there are actually a few things in my life that have happened where I can see myself during a short period of time putting on a lot of weight. So those were my 2 pregnancies. So for each of my pregnancies, I put on a lot of weight. A lot of that was actually water weight too. But honestly, with my first pregnancy, I looked like maybe I was carrying twins and there was only one. And my second pregnancy, I've had people ask me if I was carrying triplets. And again, there was only one. A lot of that was because I tended to put on a lot of water weight, but a lot of that also is because I just overate. Like, I didn't have anyone at the time teaching me or coaching me on how to like eat properly without putting on excess weight. And of course, I didn't want to put my kids my babies at a deficit. So I just ate without thinking about what and how much. So for each of my pregnancies, I put on a lot of weight. I took some of it off almost immediately after giving birth, but I always ended up at a weight where I was kind of much higher than I was before I started. And the same thing happened with my second pregnancy. I was higher than I was before my first pregnancy to start. Then I put on more weight. I lost some, but again, I ended up still higher than I was before. Another big thing that happened in my life where I know I put on a lot of weight was when my mother got diagnosed with cancer. So she was living with me at the time, and for the last 3 months of her life, she stayed in a hospice. So I was traveling back and forth to the hospice a lot, spending as much time with her as I could. And of course, in between, I was just pretty much getting junk food, like fast food, A&W, McDonald's, that kind of thing in between. Like, I'd be there most of the day, I'd run out for lunch, grab some fast food, and come back again. I put on a lot of weight during that period of time as well. Another instance where I put on a lot of weight was when I broke my ankle. So I have a 3rd Dan black belt in Taekwondo, and if you see my picture over here, just over my shoulder, that's a picture of me from many years ago when I got my 1st degree black belt, my 1st Dan black belt. So it was a really stupid accident, actually. I was demonstrating a technique in class, and my foot caught on a mat. It's just a stupid, random thing. But my ankle was really severely injured. I broke both bones in my ankle, and I shredded all the ligaments and tendons and so on. It was really bad. My orthopedic surgeon at the time told my husband that on a scale from 0 to 10, my injury was probably 8 or 9. So it was really bad. And I was immobile for almost a year with that surgery. I ended up having 2 surgeries, actually. So I had the first surgery, and then I kind of slipped in the tub kind of thing and put my weight on it. So then I had to have a revision surgery. So I was out of commission for a long time. And even afterwards, when I was supposed to be able to put all the weight back on it again, my foot didn't flex properly. So I was still kind of walking with a limp, and I wasn't quite as active as I was before because my foot just wasn't working the same way. So yeah, I put a lot of weight on during that period of time as well. After that, I actually lost a lot of weight during the medical bariatric program, which I'm going to talk about in more detail later on. But then the pandemic hit, and then I put back on all the weight that I lost, which is another reason why I'm going for the surgery, because I have tried numerous times to lose the weight, and I always end up putting it back on. So I've tried lots of ways to lose weight in the past. I've tried Weight Watchers more than once. I've tried Jenny Craig. I've done Fit Body Boot Camp, where we actually did the exercise part and the eating part, where you count your macros and all of that stuff. I've gone to the gym and had personal trainers who also made personal menus for me. And so there's been lots of things that I've tried, and everything has failed. The biggest thing that I've tried that I did the best on was a medical bariatric program that I did back in 2019. So the medical bariatric program was 6 months of a program where you had 3 months where you have only Optifast shakes to drink. So I lost a lot of weight during that time. And also during the whole 6 months, we're actually seeing the doctor, a nurse practitioner, a social worker for counseling, like a dietitian for help with, eating habits. And then we also had support group meetings. So I actually lost 72 pounds during that diet. But unfortunately, after that, the pandemic hit. Now I'm a teacher. And so everything I was doing originally, though I was spending a lot of time on my feet for teaching classes, then I ended up in front of a camera like I am right now, teaching my classes like this, sitting most of the time. So, and of course, activities outside of the house were limited. And at that time, I lived in in Cambridge, Ontario, which is a pretty busy city. So yeah, there wasn't many places you could go outside where you wouldn't run into other people. And so I ended up putting most of that weight back on. Back when I was trying to decide between going the surgery route or the medical bariatric program route, I had to do like sleep study. So when I went in and slept overnight at this sleep clinic, and they checked me out, and it turned out that I had sleep apnea. So I have a CPAP machine now. So that was my first major comorbidity with the obesity. That's the first time that it really started to bother me a lot about having the weight. We moved from Ontario to Nova Scotia back in 2019. And since I moved here, there's been some other issues coming along. So when I moved here, just to have time with my family and to have a flexible schedule, I decided to supply teach rather than just teach full time. So I supply taught for the first, say, 2/3 of that school year. And then after that, I started to get some really severe back pains. Now, I originally thought it could be because of how my ankle still didn't flex properly, so I was walking funny. So I thought that gait change might have caused the back problems. So this past September in 2023, I decided to have a surgery on my ankle where they removed the bottom screw. So when I had my ankle surgery before, I had a plate put in with some screws. When I had my revision surgery, they actually put extra screws in to make sure it wouldn't come loose again. And it was the bottom screw, it seems, that kept my foot from flexing properly. So they removed that last September. And I waited, I think, until the end of November, early December. I was still having the back issues. So that did not solve the back pain issue. So I went to see my doctor, and he ordered some x-rays, and it turns out that I have osteoarthritis in my lower spine, as well as a deteriorated disc. And those are actually things that can be caused by being overweight. So having extra weight on your body to carry around can cause those issues. So this is another reason why I decided to go the surgery route. I pretty much spent almost a year, again, after spending almost a year being immobile with my ankle issue. I then spent a year being immobile because of these back issues, so I figured out what was going on with me, basically. So back in last June of 2023, I went to my doctor and I said, you know what, this is getting ridiculous. I feel like a lump. I can't even do anything around the house. Lucky for me, my husband is really good at cooking, and he doesn't have any problem with cleaning either. And so between him and my two sons, things got done. But for me, I felt pretty useless in my own family. Like, I couldn't move around, I couldn't clean the house, I couldn't really stand long enough to cook. So finally last June, I said to my doctor, this is getting ridiculous. Can you refer me to surgery? Because I really want my life back. And he agreed, but because I was having so much issues, he also started me on Celebrex for the back pain, because before that I was just using over-the-counter stuff like Tylenol, Advil, and even Aleve, which is a specific back pain medication, and none of those were helping. So he put me on Celebrex, which did start working, but it took a few weeks to actually get to the point where it was really, really effective. So I started being able to move more, like over time, so more and more over time. But it did take me quite a while to get to where I wasn't like suffering for at least part of the day. So because I was having so many issues, he gave me my referral, but of course there's a waiting list for the surgery or even for the program. So in the meantime, he started me on Ozempic. And I don't know if you guys have heard about Ozempic, but wow, if you guys have heard of dumping syndrome, I had really bad dumping syndrome with Ozempic. So and I'm not going to get into the details because it's kind of disgusting, but I was really sick. I spent a lot of days really sick on Ozempic. On the plus side, it kind of taught me which foods are likely to trigger me, which means I started to understand which foods were too high in fat, which foods were too high in sugar, even ones you might not expect were too high in fat or sugar. But that is good in a way because now I know which foods to stay away from. So that was in June of 2023. And in August, I got my letter from the Halifax Obesity Network saying I was approved for the program. And at this point, it's the program, not the surgery. So I had to go through the program to qualify for the surgery. So there were certain things I needed to do in order to qualify for the surgery. So I'm just going to go over my sheet of the patient instructions here that we had to follow. So I had to go to their website and print out a bunch of binder handouts and assemble a binder, which I did. So this is my binder here, which is actually separated into considering. It's like a section for when you're just considering the surgery. There's a section for pre-surgery prep. So in this case, you've decided, and then you need to know what to do while you're waiting for your surgery. And then there is post-surgery prep and info. So I had to print out all this stuff in my binder and read through it, which I did. And there's also a quiz in there I have to do after reading through all the surgery. I haven't done the quiz yet, but I will get to that soon. And there's also a bunch of videos posted that we had to watch, and most of these talk about like lifestyle changes and how you kind of need to go with behavior and values as opposed to just setting a goal. I'm going to talk a little bit more about that soon because I have some books that I've been reading as well, so I'm going to talk about that when I get there. Then I had this sheet that's called the Pathway to Bariatric Surgery that I had to bring in every time I saw my doctor or nurse practitioner. Then I had to book monthly appointments with the doctor or nurse practitioner. So my doctor saw me for the first appointment where he referred me to the surgery. After that, all my monthly appointments were with the nurse practitioner. part of the problem where I live. So I live in Cape Breton, so it's kind of small here. And so there's not a lot of healthcare providers. So in my doctor's office, he actually has a nurse practitioner as well. And that's who I saw for my monthly appointments. And then also it says connect with any of the following community sports as appropriate: psychologists, personal trainers, physiotherapists, nurses, dietitians, and so on. So I have seen personal trainers in the past, but I haven't recently. I've seen a physiotherapist in the past, psychologist in the past. I've seen social workers in the past. And this time around, I saw the nurse every month. And I also spoke to the dietitian a few times, and those were phone appointments. And then I had to complete blood tests as requested. So I had to do a few different blood tests. So the clinic in Halifax sent a requisition to me, which I had to copy and use for my lab work, which was then CC'd to my doctor's office. So I've completed all these things. As of now, I've completed all those things. So this, as of today, I've gotten my blood work done. So I had an appointment with my nurse practitioner today, and she weighed me in, and she decided that she thinks I've been doing well for long enough. I got my letter saying I was approved for the program back in August, but it actually took me a little while to actually book my appointments with the nurse practitioner because I wasn't quite mentally ready when I started. I was on Ozempic, so I was getting there because I was knowing which things were okay and which weren't okay to eat. So I was getting there, but I wanted to make sure I was successful. So I really wanted to be mentally prepared to start. So it was the end of October before I had my first appointment with the nurse practitioner. And again, that was October. And you're supposed to do 2 weeks of a 1,200 calorie liquid diet, and then at least 3 months of the 1,200 calorie restricted diet. So it's actually been 5 months. So I had a slow start. I wasn't journaling right away because they want us to journal our food and exercise as well. I wasn't journaling right away. I was kind of following things, but I wasn't 100% there. So it was when I was 100% there that I started kind of tracking things, or I felt like I was ready. So today was the appointment where my nurse practitioner signed a document saying she thinks I'm ready for the clinic appointment in Halifax and for the surgery, hopefully. So the way it works where I am, because like I said, I'm in Cape Breton, which is a small area. The hospital where they do these surgeries and the clinic where they kind of prep you for the surgeries is in Halifax. So a lot of the stuff we did, as you could see from what I was mentioning earlier, is done online. So like we go onto their website, we print out all their documents, we read through all the documents, we watch all the videos that are posted online. And then when we get to this point, then my next step is that my nurse practitioner sends that document to the clinic in Halifax saying I'm ready, and now I just have to wait for my appointment. So when I see them, I'll also have some assessment with them to see if they think I am ready for the surgery. So I'm crossing my fingers, hoping that's the case. Let me tell you a little bit about why I decided to start this channel. I'm trying to prepare myself mentally, and in order to know as much as I can to be prepared for this journey, I decided to watch a lot of YouTube videos. I've also read a lot of books, but I've been watching a lot of YouTube videos. So I found those really extremely helpful. There's some that I've been watching by doctors, like the endobariatric ones, and videos by Dr. V, which are specifically for the vertical sleeve gastrectomy surgery, which is the one that they offer here in Halifax. So I've watched a lot of videos on their channels, and I've watched a lot of videos by other YouTubers like me who talked about their journey. And so I decided to do this first video because I didn't see a lot of videos before they actually had the surgeries and the prep that they did before. So I decided to do this. So I wanted to be kind of part of that community because I found it very helpful. So I'm hoping to be able to help other people the same way that those people have helped me. And also this is kind of for accountability as well. So obviously I have family members and friends who know that I'm going to be doing the surgery, but also this channel is a bit about accountability. So I have to walk the walk and not just talk the talk if I'm going to be doing these videos, right? So hopefully you guys will keep me accountable. So that's all I want to talk about today. I don't currently have an Instagram or anything for this that goes along with this channel, but I think I'm going to add one just so people can have a place to ask questions. But if you also want to ask questions here, you can just leave them in the comment section below. I will go over them before my next video, and then I can answer any questions we want to talk about. So I hope you found this video helpful. If you did, please press the like button. If you want more content like this, please subscribe. And if you hit the notification bell, you'll be notified the next time I post a video. Thanks for watching. I'll see you next time.